Hello and welcome to On the Beat with the ABC. I'm Dr. Jayne Morgan, the co-chair of the Communications Committee for the Association of Black Cardiologists, and I have with us today an ABC member, cardiologist, Dr. Adedinsewo. She is a cardiologist with the Mayo Clinic. It's a pleasure to have you here today.
It is wonderful to be here.
Let me ask you, what brought you to the ABC?
So I first heard about the ABC while I was in residency training. At the time, our chief of cardiology was Dr. Wine, and he actually introduced the ABC to me. So it's quite a minute that I joined, and I have been a member since, and I've loved every moment of it.
And by the way, Dr. Onwanyi is the president of the Association of Black Cardiologists, and also has been right here on the beat with the ABC.
Oh, great.
So that's great that you have that connection. And now that you're in practice, what is it that you do in your practice, your commitment, your dedication, things that you have done that are impactful? What would you say?
So my clinical practice really focuses on cardiovascular disease areas, particularly during pregnancy and the postpartum period. Also, I have a lot of interest in echocardiography, so I did get some additional echo training, and I spent a good bit of my time on research. I currently have a K-12 award, so I have protected time for research, and my research also focuses in the same space that my clinical interest is in. We are also looking at the use of artificial intelligence tools for cardiovascular disease detection. And I am also interested in cardiovascular disparities affecting women and people of color.
That is a lot. And you know what really caught my attention is clinical trials and how important it is to have representation in clinical trials.
Thank you. And I agree with you. It is really important to
with all of the work that you're doing, with women in cardiology, women in pregnancy in cardiology, understanding what those associations are, and also clinical research. How does that dovetail with the mission of the ABC, with the Association of Black Cardiologists?
My research focuses really on can we identify risk factors and tools to improve the diagnosis of peripartum cardiomyopathy during pregnancy and in the postpartum period. We have studies that are showing that the risk for peripartum cardiomyopathy is up to 16-fold higher in African American women compared to white women. So peripartum cardiomyopathy is a unique kind of heart failure that occurs during pregnancy, or usually late pregnancy, and in the postpartum period. And it is considered idiopathic because we don't really know why this happens, but it's really related to the pregnancy period. And this condition is considered life-threatening. It is one of the leading causes of death during pregnancy and shortly after having a baby.
It's really, really important work, because really we're just beginning to understand that connection between pregnancy and the heart, especially for women, and how that gives us an idea of what the risk is for a woman of cardiovascular risk. When we're talking about the ABC and your work in what you're doing there at the Mayo Clinic and with the ABC, how does that bring fulfillment to you?
One of the things that I value the most about being a part of this organization is how can we come together as a group to improve cardiovascular outcomes for African Americans, for underrepresented racial and ethnic minority groups. So from my studies that I kind of described earlier, where we are trying to evaluate the use of artificial intelligence tools to improve the diagnosis of cardiomyopathy, my hope is that as we do this, we can not only have earlier diagnosis of the disease, but also improve outcomes in this patient population. One more thing that I would like to add, that Nigeria, which is a country in West Africa, has the highest reported incidence of peripartum cardiomyopathy. And right now we are conducting a clinical trial in Nigeria looking at this artificial intelligence tool to see if it works and if it can improve outcomes for the women.
So impressive. We have such an impressive cadre of talent within the Association of Black Cardiologists, and you certainly exemplify that. Thank you for joining us, Jay.
Thank you so much.
And thank you guys for joining us. We'll see you next time right here at on the beat with the ABC.